Hello, everybody. My name is Saanvi Bhalke, and today I'll be presenting about blood donation disparities when it comes to sickle cell anemia. As an introduction, I am a rising senior at Rhinebeck High School and co-president of SNHS, which is Science National Honor Society, where we do monthly presentations on science topics. I am also a American Red Cross Youth and Young Adult Ambassador, where we face local issues in our regions and we make a difference. I plan on majoring in public health when I get to college, and medical school is my ultimate goal. So every 2 seconds, someone across the United States is in need of blood. However, for tens of thousands of people suffering from sickle cell disease, the right type of blood is crucial for them. So sickle cell disease, also called SCD, is the most common genetic blood disease in America, which means people are born with it. Around 100,000 people across the country are affected, and 9/10 of people being of African ancestry or identifying as African American. So what is SCD? So sickle cell disease is an inherited blood disorder that affects the hemoglobin protein, where red blood cells, which are normally disc-shaped and are easily able to pass through your blood vessels, are instead misshapen in a crescent or a sickle shape. So these cells are not flexible and cannot bend easily. So they get caught in vessels and they block blood flow, which can cause symptoms such as extreme pain, strokes, tissue and organ damage, which can be life-threatening. Blood donations can help those with sickle cell, since transfusions help increase the number of healthy red blood cells in the body, which can reduce symptoms of SCD. However, around 10 units of blood are needed for a patient every single month, and there's frequent shortages in the right type of blood to meet this need. The right type of blood is crucial when it comes to people with sickle cell, since blood types are determined by antigens. And antigens are unique to specific ethnic or racial groups. And since majority of people who have sickle cell disease are African American, they typically match blood with people who are African American. So African American donors best match with people with sickle cell. And there's a lack of African American donors, which means people with sickle cell are not able to get the right type of blood. So why is this such a big issue? Well-matched blood can decrease the risk of complications, especially for patients who need frequent or lifelong transfusions. It is crucial to increase the number of available blood donors from all racial and ethnic groups. Since patients who are getting blood for their whole entire life, they need blood that matches as best as it can to theirs, so there aren't as many reactions in the body. However, we are facing a deficit of diverse blood supply, which can be life-threatening to patients, especially those who require a very specific type of blood. Not only for patients with SCD, but also conditions such as anemia, cancer, and bleeding disorders, which need frequent transfusions. So as we can see here, African American people, there's only a 29% of a chance that they're able to find a donor that matches their blood. So we need a various supply of blood from all ethnic and racial groups. So matched blood. We have over 600 known antigens in the body. The most common ones are A and B antigens, where a person with an A antigen can only receive blood from another person with A antigens. U negative and Duffy negative are unique to the African American community. So people with SCD usually have U negative and Duffy negative antigens, which means they are most compatible with other people with U negative and Duffy negative antigens, which are typically African Americans, as you can see here. And that's the same with all other ethnic groups that have their own unique antigens. So on a scale of the United States, Black donors make up less than 3% of the total blood donors in America, which is a serious deficit. Not only Black donors, but other underrepresented groups such as Asians and minority ethnic communities also make up less than 5% of the total blood donors. And on a global scale, 40% of blood donations come from high-income countries, but only 16% of the world population is housed in these countries, which means people in lower middle-class countries who are in need of blood have trouble receiving it due to a lack of a compatible match, especially since smaller ethnic communities that are only in lower and middle-class countries are not able to receive blood because of lots of barriers, as seen here. So a lack of infrastructure is a huge barrier, since a lot of smaller communities, they don't have the budget to create a donation center. However, blood donation can happen anywhere. And partnerships with local hospitals, schools, and religious organizations can host blood drives, and people there can donate blood. However, a lot of people around the world do not trust healthcare, since healthcare is not trusted everywhere. That's why trusted individuals such as pastors and community organizers, anyone really around the community that the community trusts, when they host blood drives, it can add a sense of credibility and make it more easy for people around them to donate blood, especially sharing patient stories and sharing how blood donation can really help these people. That's an important part as well. A lack of awareness is huge since a lot of donors don't really know what they're getting themselves into when they're donating blood. They don't know why they need to donate blood. So donor education is super important, especially explaining how specific blood can help certain people. So as a part of Red Cross Ambassador, me and my partner tackled the goal of increasing more African American blood donations to help patients with sickle cell disease. So we live in Austin, which has a high African American population, and we first started off by contacting the biomedical team and learning more about sickle cell disease. Then we reached out to various Black organizations and communities, such as churches and organizations, stuff like that. And we connected them with the Red Cross in order to first set up presentations to educate them about exactly what sickle cell disease was and why they need to donate blood. And then we could further expand upon that and make blood drives. And overall, this increases donor education and raises awareness. So some key takeaways: blood donation saves lives, especially for those who need frequent transfusions. A lack of donation diversity can cause major medical issues, so it's important to receive blood from all groups. Global and local efforts need to be made to increase awareness and access. Blood shortages are not just a local problem, it's a global health crisis. Acting and donating locally can make a huge impact globally. So donate blood. Your Americans. And thank you so much to the American Red Cross, especially to the Central Texas Biomedical Team and the National Youth Council. Thank you so much to the World Health Organization, where I got a majority of my information from sickle cell. And thank you to SlidesGo, Floticon, and FreePic for the presentation template and the icons I used. Thank you to the GHLC at JHU for giving me an opportunity to present. And thank you so much to my audience for listening. Thank you.